Why is goal writing important? Well written, measurable goals aren't just for compliance or paperwork, they are the foundations of effective speech therapy. When goals are clear, specific, and measurable, they help us focus our sessions, track progress, communicate with families and teams, and make informed decisions about how to adjust therapy. They help us stay consistent across settings, provide visible evidence of success to clients and caregivers, and ensure that we're always working on what actually matters to our client. They even support funding, justify services, and meet professional accountability standards. In short, good goals make therapy better. So let's talk about how to write them in the right way. We have all heard of SMART goals. Let's review that. S is for specific. The goal should clearly describe one behavior, and it must be singular and observable. If we can't see it, we can't measure it. M stands for measurable. There must be a clear, appropriate method for tracking progress. Percentages, frequency, accuracy, probe data, whatever fits the behavior best. A is for achievable. Choose a goal that falls within the student's zone of proximal development, challenging but realistic with the right level of support. R is for relevant. The skill should be functional and meaningful. It should support real communication, learning, or participation. T is for time bound. Every goal needs a time frame, whether it's a semester or an IEP year. You need to define the window for expected progress. The SMART framework is a good foundation for goal writing, but a goal needs more specificity than the framework provides. Consider the S for specific. We know that we really need it to be specific, singular, and observable. So, what does specific, singular, and observable behavior mean? Let's start with the foundation. What is the student actually doing? Your goal should describe one specific observable behavior, not two, and not a general category. For example, increase expressive language is too vague. Are we targeting vocabulary, sentence length, asking questions? And don't combine skills. Answer WH questions and retell stories is really two goals. It's best practice to keep it to one behavior so you know exactly what you're measuring. You should always ask, can I see this behavior happen? For instance, you can't observe demonstrates understanding, but you can observe points to the correct object when asked a question. When it comes to making a goal, you need to choose the right measurement method. Now that you know what you're measuring, the next step is figuring out how you'll measure it. A lot of goals use percentages like 80% accuracy, and that works if the behavior happens in a clearly defined, countable trial. For example, we'll label pictures with 80% accuracy during structured tasks. This works because the trials are consistent and the response is observable. But percentages don't always fit. For example, we'll express a need in 80% of opportunities. What counts as a need? How do you know they had one and didn't express it? If you can't tell when an opportunity occurred, a percentage is meaningless. Other goals use 4 out of 5 opportunities. That can also work, but again, only if the opportunity is clearly defined and observable. Follow one-step directions in 4 out of 5 opportunities is usually fine. You're giving the directions. But participate in a conversation in 4 out of 5 opportunities needs more clarity. Again, what's an opportunity? Who initiates it? What counts as participation? Bottom line, use percentages or number of opportunities when the number of trials is easy to determine and you can define and observe the trials. If the behavior doesn't have clearly defined opportunities, consider frequency counts or a rubric. Use frequency counts when you want to count how many times a behavior occurs. For example, use core vocabulary words, for example, want, go, or more, at least 5 times during a 20-minute structured activity. This is ideal when there aren't defined trials or when you're looking for general use rather than correctness. Use rubrics when you're measuring complex, multidimensional skills like narrative retell, conversation, or written expression, where a simple right or wrong score doesn't capture the quality of the response. For example, retell a familiar story with an average rubric score of 4 out of 6 possible points during a structured retell opportunity. Rubrics are useful when you need to assess not just whether your student, client, or patient did something, but how well they did it across multiple dimensions. Just remember that when you write a rubric goal, you need to provide the rubric. Pro tip: rubrics are especially useful for long term goals that involve integrated skills. Take narrative retell. To do it well, a student needs abilities in semantics, that is relevant vocabulary, syntax, that is varied sentence structures, and pragmatics, that is maintaining coherence and relevance. Each of those skill areas could be addressed in a short term goal, and the rubric gives you a way to bring them all together and evaluate the broader outcome. Remember, the method of measurement must match the behavior. That's what makes a goal truly measurable. Here's another thing to watch out for: stacking too many layers of measurement into one goal. Take this example: label objects with 80% accuracy in 3 out of 4 opportunities. At first glance, it seems okay. But it's actually redundant. If you're already measuring accuracy, you don't need to also specify 3 out of 4 opportunities. Now you're tracking two separate things and it's unclear which one takes priority. That makes the goal harder to interpret and harder to measure consistently. Here's another example. Produce 3 MLU utterances with 80% accuracy in 4 out of 5 opportunities. It sounds detailed, but it doesn't make sense. MLU is already a measurement. It's the mean length of utterance. You don't need to add 80% accuracy or 4 out of 5 opportunities on top of it. And if you're saying 80% of utterances are 3 morphemes long, your average MLU would actually be higher than 3. That defeats the purpose and makes it harder to track real progress. Each extra layer adds confusion and makes the goal harder to use. The more criteria you stack, the more likely your goal becomes unusable. So stick with one clear behavior and one clear measurement method. Now let's talk about something that's easy to forget when writing goals: context and cueing. Context tells us when or where the behavior should occur. Is this during structured therapy tasks, free play, at home? It matters because our clients may be successful in one setting, but not another. Cueing tells us how much support is allowed: independent, with minimal prompt, with a model. Don't leave this to interpretation because everyone has a different idea of what support means. A good goal spells this out. For example, we'll label common items with 80% accuracy during structured tasks with minimal verbal cues. Now we have a good idea of what we are working on. Let's talk briefly about goals and objectives, or as I like to call them, long term goals and short term goals. A lot of times I see long term goals that are general or vague, like increase expressive language. That's not good enough. Long term goals must be just as clear and measurable as short term goals. They should be specific, singular, observable, achievable, measurable, and time bound. They should include context and cueing. Short term goals should be written to build toward the long term goal. If your long term goal is about increasing MLU, then your short term goals should focus on related language production tasks like combining words, using grammatical morphemes, or increasing utterance length. Don't write a long term goal about MLU and then have a short term goal about following directions. One doesn't lead to the other, they need to align. And finally, keep it simple. Sometimes people try to make goals sound polished or sophisticated by adding jargon or complicated phrasing, but that usually makes the goal harder to use. If someone else had to walk into your session tomorrow and take data on your goal, would they know exactly what to track? If not, rewrite it. I like to use this acronym to remind myself: KISS. Keep it simple, sweetheart. I say sweetheart because the original version ends with a different word and it's not very nice, but the point still stands. The best goals are the clearest ones. So let's review what makes a strong, functional, and meaningful goal. It uses the SMART framework as its foundation. The behavior is specific, singular, and observable. The measurement method fits the behavior and doesn't include stacked or conflicting criteria. You've defined context and cueing. Your long-term and short-term goals are aligned. And you've remembered to keep it simple, sweetheart. If your goal meets these criteria, it will guide your therapy and you will show